Sesame Lane.
How you going?
We just wanted to go through with you our procedure and policy on how to administer medication to children that attend our service today.
It's really important that you familiarise yourself with this policy. Obviously it's something that we do day to day, so you need to make sure that you know exactly what procedure needs to take place. You can obviously read this on Way We Do and accept that policy on Way We Do, so we suggest that you get on each day checking your Way You Do policies to make sure what is being revised and updated for you to accept. Okay. So if a parent comes to you in the morning with medication for a child, you need to follow a few steps to start with. First of all, you would take the medication from the parent, but also direct them to the medication folder to get out a medication form.
Once you have the medication form, it's really important that you fill that in with the parent. So you need to make sure that the medication has a doctor's label on, it has the child's name, and it is within expiry, so obviously it's not out of date medication, and that it has the dosage that we have to give as well. So once you've got that information, you need to then pop it onto the form and fill it out with the parent. You need to make sure that you label the child's name, the date of birth, the type of medication that we will administer, and how it will be stored. So some medication needs to go in the fridge, and it's important that that is refrigerated. If it doesn't need to be in the fridge, you need to make sure that it is stored in the correct place. And then the parent needs to sign to authorise that we can give them the medication and date, and then the educator needs to sign and date this too. And then as you will go through the form, you'll need to complete it with the parent and just make sure that the time, the dosage, and how the medication needs to be administered. So it might be oral, it might be ear drops or eye drops, that you pop that information on. The parent does have to sign again to authorise this to occur. And then once all that information is completed, the parent can then leave, and you will then take the medication to where it needs to be stored.
So if you aren't normally in that child's room for the day, it's really important that you pass on this information to their correct educator for the day, because obviously staff being on different shifts and different times may not know this information, so it's really important that those information is passed on to the relevant educators in that child's room for the day, because we would hate to miss giving the child a dose at the correct time that's been written on the form.
So once it becomes time for the child to have the medication, you need to retrieve it from the area in which the medication is stored, and then you will go through the procedure of administering it. So we will administer some medication today. So we have little Johnny here, and Johnny is going to have some amoxicillin. Okay, so we are just going to double check. It is oral, that we have to administer. And how many mil?
5 mils for Johnny, please.
Okay. Okay, so can you just check that there's 5 mil?
Yeah, and I'm just going to check that this is his medication, and it says 5 mils and the expiry date is in date. So.
Okay, ready? There we go.
So once that's been done, you need to make sure that then you are filling in the next part of the form to say that you have administered that medication, what time you administered it, how much you administered it, and also the person that witnessed you giving it to the child. Once that's all been filled out and signed off, then you can obviously go and take the medication back to where you got it from, make sure it's locked up in a safe place, obviously for the next dose, or for when the parent needs to come and collect it.
Yeah. Perfect. Okay. And then the family, upon collection of the child that day, will sign to authorise and accept that the child has had that medication, and will sign to say that they've collected that medication so they can administer it and follow it up at home as well too.